Well, let's go ahead and get started. Welcome to RISE. Excited to have everyone on campus today. We've got about 5 more seats in the front if y'all want to make some new friends up here in the front row. My name is Bettyjo Bouchey. I'm the moderator for this esteemed panel. My role here at the University of Vermont is Chief Officer of Professional and Continuing Education, which is a long title sort of encompassing several aspects of our portfolio here at UVM, everything from how we serve our pre-college learners and our non-degree learners to graduate students, workforce development, online students, and then as folks retire with our Osher Lifelong Learning. So we like to talk about our work as sort of the wrapper around the institution, all but our traditional residential students come through our office. So we're just delighted to have you here today to really talk about this way that we can engage our communities, how we can all collectively partner and rise together, pun intended. Thank you, applause for my punny little joke. I'm also on the board of the Leahy Institute, so it's always fun to bring the puns into the conversation. So thank you for indulging me. We have some esteemed panelists here today to talk to you a little bit about building effective partnerships, effective teams across different types of organizations, which sometimes is kind of a trick, right? If you partner with a university or a utility or a medical center or a private organization, you all might have different aims, right? So there's a unique aspect to these types of teams and partnerships that our panelists will discuss with us today. So without further ado, I'm going to hand it off to each panelist to introduce themselves. They're going to talk to you, they've sort of picked some exemplar projects, talk to you about those for a couple of minutes, and then we'll get into some moderated questions and we'll leave some time for Q&A at the end. Does that sound okay? All right, wonderful. So I'm going to hand off here. Are you ready, Dan? All right, we're going to switch places for a moment.
Excellent. Good morning. Can you hear me okay? Not too loud either. Okay, I hope. Okay. Well, I'm really grateful to be here participating in the RISE conference. So first of all, thank you to Tricia, Joe, and the whole team. Summer, I think you're here, and thank you so much for your support. I'm at Vermont Electric Power Company. I'm manager of innovation, and my role is to really think about how we can keep the grid reliable, secure, sustainable as it transforms. And what that means is that we have to think collaboratively. That's part and parcel with how we work and what we do. And our memorandum of understanding with the University of Vermont that we signed a few years ago, thank you, Andrew, I see you here, really brought that key mission that we have to create a sustainable Vermont through our for-profit structure that delivers cooperative-like value to Vermonters. We actually saw University of Vermont also having the same vision to create a sustainable Vermont. So once we connected those two dots there, we were thinking, okay, there's something here that we can build on. So we learned about the availability of LiDAR information, data, that was going to be published from the Vermont Center for Geographic Information. Has anyone heard of LiDAR before? Any folks in the room? Okay, great to see this. Long and short, we have the opportunity to have unprecedented levels of data, to identify where on the system there are risks, and we can look at how we can get more out of the existing grid. We have affordability challenges in the energy system. We have affordability challenges all over the state. And really what this was about was bringing the partners, as you see here together, Leahy Institute, the UVM Spatial Analysis Lab, thank you, Terry, create within the College of Engineering and Mathematical Sciences, as well as our partners at VCGI, and electric utilities all across the state that all share an interest in better understanding the risks to the power system to keep the system more affordable and get more out of what's there. So by way of example, to really show how this partnership and the collaboration really happened, I want to start with the data and information that's already out there. This is Google Maps. And if you look at this, you can see South Hero. South Hero is out there. You have all this information about South Hero. But what would happen, right, if a storm came through? ice storm. Folks may remember that from back in the day. All of these potential risks are out there, but this level of detail doesn't help us tell that full story. So working with our partners in the Spatial Analysis Lab, we are actually able to extract a three-dimensional point cloud of all of the trees and infrastructure in that area. And by virtue of the really advanced work in computing that the Spatial Analysis Lab brought in, typically what they'll do is they'll actually look and do assessments of the health of trees and extract the power lines and say, we don't need to look at those. They're actually not useful. They're not relevant to us. But working with Jarlath O'Neill Dunn, who unfortunately, of course, tragically passed away, he was a major proponent of this project. He said, well, we could just reverse engineer it. We could just detect the power lines. So thinking outside the box, we had Jarlath and Paige, of course, at the Spatial Analysis Lab now as well, thinking, what can we do to get this three-dimensional model? And once we do that, we can identify risks on the system due to the vegetation contacts on particular lines. Now, this is half of the story. So now you have this geospatial risk. Let's actually look at what the power system does in response. And this is where our partners from the College of Engineering and Mathematical Sciences come in. We have unprecedented levels of geospatial data mapped into the power system, and we can see that the whole island was impacted if, in fact, this event were to occur. Now, we are able to then do advanced analytics on top of it, looking over time at the transmission system being simulated in parallel with the distribution system. This is cutting-edge ways of working that just haven't happened before. But the reason they need to happen, because this is how you get a more affordable grid. You look at all the different scenarios of what's going on, you see where the risks are, and you try to step in and say, how do we get to a better spot? A lot of this comes down to data sharing, people working together. This blueprint here shows, for the first time, we have secure data sharing methods between our partners at Vermont Electric Cooperative, Velco, feeding into this and simulating, as I was saying, the transmission and distribution systems together. This is only possible through the infrastructure of UVM. It was only possible through the Memorandum of Understanding that we signed with the non-disclosure agreements. All these little mechanisms built up so that we can actually see a more affordable grid and what that would look like. And I would just make a plug. Through this project, we're actually able to get blocks 1 and 2 done. I believe that's right, Terry. We're going to be moving those forward. Unfortunately, there's some challenges with the LiDAR delivered in block 3, but there's a lot of learnings that came out of that. So we're talking about LiDAR data, being able to take more insights out of that system, and then working with teams on how to get more value from the grid. There are different people speaking different languages about these different systems, but we have a common purpose. So if we focus on that common purpose, we stay creative, collaborative, and we have a sense of humor about some of these things, because not everything is simple when you work between institutions. I think as all of us know, there's real value to be had.
All right, we're going to notch the IQ back 20 points. I'm going to talk now. Nice job, Dan. So I'm the Commissioner of Housing and Community Development at the state of Vermont. I'm Alex Farrell. This is going to be fun for me because if any of you normally see me talking, I'm talking about housing data, and land use and permitting. I don't have to talk about that today. That's pretty cool. So we're going to dive into something that's directly related and more focused on how our municipalities access resources. So I'm going to talk about VERTA, the Evaluation of Rural Technical Assistance Project. This is UVM, the Leahy Institute, and Center for Rural Studies partnering with us to study this issue. So I'm going to give you a little bit of the background, and then I'm going to talk a bit about how we're approaching this. So Act 181, this was a broad, sweeping reform of Vermont's land use and permitting as regards Act 250. I hope folks are familiar with Act 250 broadly. This is how the state controls land use. I have a lot of feelings about Act 181 and the way it worked and the balance that was struck. And I'm not going to make eye contact with Andy Julo or Charlie Baker when I say that, because they know my feelings. And we're not diving down that rabbit hole today, guys. But the good news is there's some really important introspection that happened as we evaluated the future of land use. So I'm going to give you the 1,000-foot view. Act 181 said, hey, we have been doing land use in Vermont the same way for 50 years. We need to rethink this. We need to allow for growth in areas where we know we want to grow, and we need to make sure that we conserve certain areas where we know there are these critical resources. So in the process of that discussion, we heard from different legislative stakeholders who are in different parts of the state that felt really differently about that. As this conversation unfolded, what it started to look like was, hey, we're going to give the municipalities with resources, with staff, with access to capacity, a lot of opportunity to move forward into the future and to grow, and we're going to alleviate some of the burdens of state permitting. If you don't have that, it's going to be harder for you to move forward. So to paint a picture, Roxbury, small municipality, I don't know if they even have a single full-time staff member, but if they do, they are really just trying to make the town run. Those are the towns that are worried and saying, hold on, you're setting up a whole new system that says, if I'm going to grow, I need to be able to, display robust zoning, robust land use and permitting at my own level. That's a lot to ask. So are the more equipped towns just going to step into the future and grow and look great and shut the door behind them? Now, I'm painting a little bit of a bad picture. There was a lot of great stuff in Act 181, right, Charlie? Yes, it was. It was good. But that's the fear. And who we heard this from was a lot of legislators who actually ended up voting for the bill. And there's a cohort of legislators known as the Rural Caucus. This is rural Vermont coming together and saying, forget party label, we just want to speak up for rural Vermont. And we're going to make sure that we're not left behind. People have heard the two Vermonts, right? This is sort of an age-old debate here in Vermont where you've got Chittenden County and Northwest Vermont growing and having, sort of robust economies and other parts of Vermont feeling left behind. Well, this sort of hits at the heart of that. And so the Rural Caucus said, look, we can get on board with this because we do see the logic. We do see the opportunity for the state here. We do need to reform Act 250 in our land use laws, but we also don't want to get left behind. So make sure that we take a look at this whole thing and how we're accessing resources. And so that's what we are asked to do. And so in the past, when we've approached this problem, I'll give you an example. During the pandemic, there was literally hundreds of millions of dollars that flowed through Vermont. And these ARPA funds were available for all kinds of projects. We spent $600 million on housing. We helped implement new infrastructure in municipalities. And when we looked at a map, we started to see the same municipalities over and over getting these awards, or at least the same counties. And the municipalities that were equipped to apply for these funds and to administer them and comply with federal regs, they were the ones getting all the funds. And so it's this perpetuating cycle where Roxbury's saying, whoa, hang on, how do we access this? So how did we try to address that during the pandemic? Well, the administration thought up a great way. They said, we're going to create another grant program. Yeah, you can apply to this grant program to help get capacity to apply to the grant programs. It's called MTAP. And look, in some communities that helped because then they could say, hey, regional planning commissions, hey, RDCs, hey, X, can we pay you using this money? And then you help. And in a lot of communities, that works great. And if your RPC and RDC has the capacity to take that on, that's great. But our regional planning commissions have a lot on their plate. And we can't always just say, hey, town, just let your regional planning commission take care of that. They've got a lot on their plate. So this project is, let's step back. This cycle that we're perpetuating of if you have resources, you get more resources. If you don't, I'm sorry, isn't going to work. So we, at the Department of Housing and Community Development, we partnered with the Center for Rural Studies to evaluate the whole system, this current state. What are the systems of rural technical assistance right now, the various organizations that in one way or another do that, and what do we need to change? And so that's the goal here, right, is let's take a look at this and what could we change? This is where the team gets really crucial. So you can see right here the partnership between the state and my team at DHCD. Notice you don't see my name on there. I don't do any real work, but my team does. They do great stuff. And we're partnering with this long list of stakeholders who actually deliver technical assistance to our communities. I'm going to point to one logical flaw in this that I think we're going to dive into more later. I am, my department, and all of these stakeholders, we are the system that's delivering this. We are what has created this perpetuating cycle that has us worried, has rural Vermont getting left behind. How are we going to point to ourselves and say, oh, here's what's wrong. Here's what we should be doing differently. That's where UVM comes in. And they have been so key at being the person outside of the bubble to say, okay, let's stop, let's evaluate what we've done, why we're here, and how we could be different. You need that in a good team. You need someone who can come in and be somewhat irreverent to the current state and just ask the questions that might feel foolish, but just reset. This timeline is in handouts on your table, so the timeline I don't think is as important here, but now that you understand the concept, I'm going to dive a little bit more as we go down. We're going to talk a little bit more about how we structured our team. So I think I'm passing it off to Roz now.
Yeah, hi everyone, can you hear me okay? I tend to be a little bit of a minimalist, so I have no handouts and one slide and this is it, so I just want an expectation set. My name is Roz King, I'm the Division Chief of Research for Emergency Medicine over at the Larner College of Medicine, and I'm still figuring out exactly how to describe what that means, but in a nutshell, I help facilitate and support any of our research efforts that in the end result in improved care or access to care through an emergency medicine lens. And so that means going all the way from what we call the bench to the bedside, and so it means it could be anything from Dr. Booker's bench lab that looks at the microbiome of the gut and how it's impacted by TBIs, to the bedside where I do some work on low barrier access to care for our patients. And so the thing I really love about emergency medicine is when people are like, what kind of research is that? And honestly, it's everything. You could make a case for anything being emergency medicine related because we're really proud to be that safety net for our community and we encompass so many different things. And so a lot of my work, I have a lot of research interests because I tend to be easily distractible, or so I'm told, but my main focus is on anything around low barrier access to care. So a lot of the work I do is around substance use disorder. And so I have, I'm on my second SAMHSA grant, Substance Abuse and Mental Health Services Administration, which I'm not supposed to talk about, but still exists currently under our administration. And they're kind enough to fund me to do that work. And so when we started, it was about ED initiated, so emergency department initiated buprenorphine or methadone for people that show up to the emergency department. So we're there any day, any time. If someone comes in, we can get them access to treatment. And I'm really happy to say it's evolved over time to now include anywhere within our hospital at UVMMC. So any of the inpatient units, ICUs, anywhere in the hospital, we've now broadened out to include CVMC, which is another hospital in Barre, Vermont. And then we have our partners in Northern New York that are also now part of the STAR program. And then thanks to Leahy Institute funding, we were able to fund an arm of STAR called PREVENT. We have to stop giving things fancy acronyms because I can never remember what they stand for unless I'm looking at a piece of paper. But the nutshell of it is that we are now able to initiate people into treatment in the pre-hospital environment. So when someone calls 911 or a patient has 911 called for them on their behalf, maybe they're unresponsive because of a non-fatal overdose, or they're acting a little strange out on the street and a bystander calls 911, a majority of those calls result in the patient refusing transport for whatever reason. And that's kind of complicated, but they don't end up entering the walls of our emergency department. And so we really wanted to find a way to make sure we can bring the care to them. And so much of what we do is about bringing the care of the emergency department outside of those four walls. And so now, thanks to funding from the Leahy Institute, we're able to initiate treatment for people before they ever, or sometimes ever, even get to us. So as you can imagine, a project like that has so many different parts and pieces, and we need so many members of our team. And so I'm excited to talk to you a little bit about that today.
Great. Well, thank you, panelists, for these lovely introductions. We'll drop the IQ down, perhaps even lower to me at this time. I think what we'll do is we'll sort of shift into some moderated Q&A, and I would encourage you as an audience, we will have about 15 minutes at the end for your questions, so maybe jot down a couple as we're engaging in some conversation here. I think I'll start with you, Roz, partly because you just said something that sort of surfaced it a little bit. Each of you discussed sort of these diverse groups that you're bringing together across the entire state, across different types of missions to solve really big, perhaps wicked problems that maybe didn't feel solvable in the beginning. And I think sometimes that can probably even feel a little overwhelming and just like, gosh, we're trying to do this big thing. How do we do that? So what are some of the aspects of bringing that team together, those teams together, do you find are really helpful?
Yeah, so I think that's evolved for me. Like I tend to be a learn as I go type of person. So a lot of the STAR work started out in 2018. And when I think about what our team looked like then versus what it looks like now, it's so different. And so I think the first thing is being really open to how that can change. So who you think is your team at the beginning, and then suddenly you meet all these people along the way and you're like, oh, we need that perspective. And so for us, it meant being really open to broadening our horizon, our purview on what we thought the problem was. So, you know, when we started this work with substance use disorder, we have an addiction medicine specialist and we have some emergency medicine representation and we have some people from our outpatient clinics, and we were like, great, that's multidisciplinary, interprofessional. We love those words and they look really great on a grant application, like we check those boxes and we're doing it. But then as we work, we're like, well, hang on, we don't have anyone with lived experience here. Like, we need peer recovery coaches who have that lived experience. We don't have representation from DOC. So many of our patients interface with that world. And so being really open to the idea that our lens is super narrow at the beginning and it just gets wider. And so allowing that in. So just last week, we welcomed new people to our team because we're like, hey, we really need this perspective. And then just recognizing that representation matters. And I think we're used to hearing about that in like a DEI space, but broader than that, like we have to have representation from every angle of this problem. And so I think from the healthcare network perspective, I don't think any of the healthcare network leaders would like me saying this, but we tend to be sometimes really inward facing. Like we think we have all the players in our house, because there's so many of us, there's so many different roles in there and different professions, but we really need to look beyond that, and our community can really help form those teams so much better.
Yeah, I love that aspect of sort of consumers and users of the solution really being engaged in the process, or at the very least giving feedback along the way. Alex, Dan, anything that you would add around Roz's points in this effective team building question?
Yeah, sure. So, you know, I think Roz hit on a lot of the key points in that, you know, if I think about our project, if we aren't going to, and I literally mean going to the municipalities, the towns, these small towns, and asking them, how could you be supported in a way that you could access state grants, federal grants, resources, update zoning and bylaws? If we aren't literally going to them and asking, they aren't going to. It's not that they don't have the wherewithal, they might not just have the time. They might not be able to understand where Act 181 falls and the importance of what's going to impact their town's future. So we have to go to them to solicit their input, and we have to sort of, you know, walk through scenarios. So they need to be at the table. Expecting them to be at the table throughout is unrealistic, and so we can make sure that whether it's the Vermont League of Cities and Towns or you know, folks from regional planning commissions that represent them, there can be stakeholders at the table that represent their needs, their views, what they've heard from them. So that's critical. But the one point I'll add is something I started to touch on. You need a fool at the table. And what I mean by that, and I play this role all the time in my department, sometimes intentionally, sometimes just out of circumstance. There has to be someone ignorant at the table to just ask the question, why is the system that way? Well, why can't we give them the grant? Why is that requirement there? And asking those questions, while maybe frustrating to the stakeholders who understand and operate the system, actually reveal some oftentimes either flaws or some really good reasons behind our thinking, but they at least give you the opportunity to make sure that, yes, we want to reinforce this aspect, or no, we can strip this away. So having a fool at the table is actually really, really important.
I would agree entirely with what Alex said, with the exception that I wouldn't call it a fool. I would say you'd want someone to stay curious, someone who's constantly staying curious with you. Totally agreed on the criticality of that. And for us, what we did was we worked backwards, right from, okay, we have a power outage. You have a mission critical event. Why did that happen? And there's someone responding to it, thinking from their standpoint, thinking from the team that's actually going to be addressing this, and working backwards from success in terms of helping them, number one, prevent that outage to begin with. That's number one goal. But also two, when they have that happen, what information can help them? What can drive them? And I would agree also about the necessity to be realistic about what you can do in terms of reaching out to project partners. So to engage them at the front of the project and say, here's what it looks like, and then that's what guides you. That's what drew us all together. So for our use cases, once we started thinking about an emergency response scenario, that made everything simpler.
Excellent. Yes, I do like the sort of repositioning of curiosity here. I think, I do wonder how things would feel right now if we were all just a little more curious, right? And perhaps everyone on campus today is very curious, but if the greater society were more curious. Speaking of curiosity, as we heard about a lot of different partners, right? Some very long lists were presented. Are there aspects of organizations that you look for when you are trying to bring a partner team together? You're representing three very, prestigious and unique organizations. So if there were people in the audience that wanted to partner with you to solve a problem, what would they need to look like? And just feel free to jump in. You're making eye contact, Alex.
I'm in. And I'm happy to take it first because being the state, you represent a different, I'm a very different entity than say a nonprofit or a private entity. So if it's going to depend on the project that we're undertaking, but let's say in this case, it's a system review. Well, we need to engage with people who are beneficiaries of the system and people who administer the system. But what I look for is who can bring resources. So that resource could be a few different things. So it could be in the case of, let's say Preservation Trust of Vermont. The resources they bring is financial, right? So down the road, they could literally help fund projects in municipalities that need it. And there's a few stakeholders in our group that can bring that. But in the case of the Center for Rural Studies, Leahy Institute, what we look for, and the reason that they were at the top of our list when we were asked by the legislature to do this, is who complements us? Who can do all of the things that we can never do? We have money, we have staff, but we don't have the ability to do research. We can't do outreach in the same way that, say, the Center for Rural Studies can produce surveys. So who can complement all the things that we lack? And so if someone's approaching us, oftentimes it's because they have a solution that we do not have. And I gotta say, sometimes that's just data. Oftentimes someone just has looked at a problem in a way that we haven't, and they've come to us and they just want to reveal something. And so, with Michael and Andrew from Leahy Institute, what I can say is right off the bat, our team felt like there was new learning. There was new learning for us because they had access to things that we don't have access to. So, I'd say that probably has been the most important part of having UVM join us and sort of lead this study.
Ron, Stan?
So I think that the key for us has been to, first of all, have an alignment on mission, right? And once there's an alignment on mission, things click, as I mentioned before. One point that I do want to just emphasize here is that we also are looking for a talent pipeline. So Amanda Van Franken is here from the UVM Career Center, is a key ally here within University of Vermont for Velco and I know many other industry partners. And we also are, of course, working with Spatial Analysis Lab, which has many undergraduate students working for your team in terms of processing the data, as well as the Create Center. And Maz Almasaki, thank you for being here. And just to show this, right, these are partners that are in the room right now showing up. So that just speaks for itself. but a talent pipeline of people, those are those curious people during the project who are asking those questions, but also getting training on the future system that we know we're going to need to be prepared for. So we're talking about a level of competency and workforce development, really, as the keynote spoke about, that also is essential here. So for us, those are the types of partnerships that really work. Alignment on vision, but also a path forward in terms of that talent pipeline. That's really what does it for us.
Yeah, I think, I live at this intersection between the Larner College of Medicine and the UVM Health Network, and luckily there's a lot that doesn't align there, but the thing that does align is whether it's person and planet or patient, it's the center of it. And so that's really what we look for in our partnerships is, we're resource rich, right? Like we can have data specialists, we can have people that are good at graphics, we have all these resources, but what we're looking for in true partners is people that, like you said, it's about the mission. And so if that patient or person is in the center, if we agree on that, then we're going to have a strong partnership there.
Excellent. I like that we ended on the note around alignment. One of the things that I think is really interesting when you go to a conference or a trade show, a lot of what gets presented are successful projects, right? You want to learn from your peers, from other sectors, what worked. Perhaps what we don't talk about as much is what didn't work. So my first career was in startups and the entrepreneurial, aspect of small businesses, and we learned to fail fast. And in fact, we would sometimes seek it out, right, so that we could learn from it quickly. So tell us a little bit about failure. Have there been? We're all friends here, right? Have there been some failures, and what were some of the ways that you righted those ships?
So I would introduce a concept for your consideration here, a quality failure. Quality
Excellent.
failure, we want a quality failure.
I will allow it.
A failure from which that we learned from. So one of the assumptions that was made about the LiDAR data that was delivered to the Vermont Center for Geographic Information was that the planes that were flying above Vermont, pointing their lasers down at the earth and bringing back this amazing amount of data, that they would have the type of lasers needed to cover all of the infrastructure that we were seeking to bring back. So that would have been the conductors that you see along the lines, as well as some of the poles. What we found was that it turned out that given this particular spec and the need to fly at a particular height, this plane actually brought back data that was suitable for some use cases, but not for others. So on the one hand, right, we had all these plans about what we were going to be able to do with all of this data once it came in. And the truth was, well, we did not meet that spec. That's true, and it's important to acknowledge that, right? We did not meet that. But because we had curious and creative partners, we said, well, wait a second, what can we do with this data? And it turned out there was so much that we could do. There was so much analysis, just like what I just showed, that we could build on top of it. And more importantly, be able to build the case for a revised specification for VCGI moving forward that will allow them to de-risk their flight in the future. So that will increase the return on investment. That ultimately is what they need to prove to the USGS that actually pays for this. So that's all part of this. We need to be able to tell those stories of the quality failures, acknowledge them. Thank you for the question. I should have started with that. It's a great question. But from there, getting partners who are creative and curious with you to then redefine what success looks like.
Great.
Yeah, I can be brief because the example that comes to mind ended up being a tremendous success, but there was a moment of serious risk of failure. So we released what we call our Homes for All toolkit last year, and the goal of the initiative overall is to expand the number of people throughout the state of Vermont that are doing small-scale development. So putting an ADU behind a home or converting a single-family home into a 4-unit, that type of stuff. And at the outset, we were engaging with, and we did actually continue to work with a partner who was outside of Vermont. They were not a Vermont-based consulting firm. And at first you could tell in the engagement, it just did not feel like they were talking about our state, didn't feel like they understood the constraints that we were under. And there was a moment of like, do we need to disengage? Do we need to put out a new RFP and try again? And thankfully, our team persevered and said, let's have a reset. And literally, it was as simple as, and I think this comes back to aligning the mission, just an in-person discussion, visits in communities, looking at buildings, looking at what infill used to look like in Vermont, looking at how things have changed and what are we trying to solve for. So I think just this realignment of purpose, and now I think it's probably one of the most successful initiatives that we've been working on, and I encourage people to go look at our Homes for All toolkit.
Roz, how about you?
I think a lot of what you just said really resonated, even though our paths are pretty different. I think when we have had missteps in the work we're doing, it's because we haven't gone out there on the ground and really taken note of what's needed. And so, like I said, this project, the STAR project specifically, started out in 2018. And when I think about how we started, it's so easy as a healthcare provider, as a researcher, to be like, all right, I know what the problem is. I see it every day. We've got a great team of people, like, let's go. And that's kind of what we did, embarrassingly. We went out there and we realized very quickly we need to take like 20 steps back and go out and talk to people. We need to talk to members of our community, have that patient and family representation in what we're doing. And I think that was such a big lesson for us to learn, is that, we have some big brains, but sometimes they move too slowly. And so we need to really take some steps back and be a lot more intentional and recognize how much we have to learn from people out in our community in order to serve them the best we can.
Mm-hmm. Great. This morning, our keynote was sort of talking about confidence in higher ed, and had the cute graph around. Cute doesn't feel like the perfect word in this moment, but the graph around sort of perspectives on scientists, right? And it strikes me that there's some resonance in that slide around, can we communicate? Can we be open-minded? And I think this is a struggle for all of us as we work through these projects. Maybe I'll ask my last question of sort of like the moderated piece of this, and we'll move to the audience just to prime you for your questions. But let's end on a positive note. This morning we also talked about public interest research, what we might call it community engaged research, lots of words for let's research something for a common good, right? To again collectively rise together. So what are some of those success factors in community engaged research? And maybe I'll start with you, Roz, if that's okay.
Yeah. So kind of piggybacking off what I just said about bringing in those community collaborators into our teams and working with them. I feel like I'm just telling you all the things we did a really bad job at. 2018 was a rough year for us. But we started to bring in these collaborators, and we're like, great. So one example is not necessarily the Prevent project I told you about, but we wanted to do EMS research, so pre-hospital research that involves our ambulance colleagues, so those that are out in the field. And we knew we needed their support, so we're like, great, we'll get them on board. We threw out the word partner and collaborator. Now looking back, very disingenuous, but at the time well-intentioned, right? I'm being brutally honest, it's like a terrible flaw I have. So we brought them in as collaborators. This is great, they'll be on our meetings, it's wonderful, they're part of the team. We did the research, they helped us collect the data, we had meetings with them where they'd come every month, we'd tell them about it, and then crickets. And they reached out and they were like, hey, whatever happened, by the way, with that project? And we drew all that blood, and we still have all these tubes, and what already happened? And we'd gone on to present at conferences, we'd published papers, and none of it was intentional, but the work was done. It was great, thanks a lot. And it was a done deal. And what a horrible mistake that was. And I'm embarrassed. I'm so glad I'm saying it in front of a room of people as I'm sitting on this panel. But it was a huge lesson for us, is that it's not just a title. Like, you're a collaborator, you're a partner. That's great. It looks great on your grant applications. It sounds wonderful. But there's so much follow-up that comes from that. And it's not just putting them on the team on paper. It's not just having them show up to meetings. But if you want to welcome them in, you have to truly count them as partners. And that's not something we were doing. And honestly, it's taken years to recover from that. That feeling that left them was horrible. And I'm really glad to say now with things like the Prevent project, it's a completely different landscape. But I think you have to be really intentional with that. And I feel it in all the meetings we have. So in our STAR meetings, for example, I think many of us can relate to, you sit on a meeting and whoever's running the meeting asks a question and everyone kind of goes quiet. And I don't know if you've ever been that person, maybe it's just me, but it's like, well, she doesn't mean me, though. Like, she's asking the smart ones on the team. I'm just kind of here because I'm on the invite, but she definitely isn't asking me. I don't, does that relate? Can anyone relate to that? Yeah, that happens to me all the time. And I'm usually running the meeting, so I need to get over it. Imposter syndrome is real. But you sit there and you think, and so now as someone that facilitates a lot of these meetings, or as the PI of this grant, I want to call on those people. It's my job to elevate those voices and ask them the question. So a lot of times in the meeting, I clock on who those people are, and I'm not going to name them, but I know who they think they are, and they think their voice isn't known. But I'll say, hey, Emily, her name isn't Emily. What do you think about this problem? And you can see the like, oh my gosh, and then usually they have the best ideas too. Like, how often have you also been that person in the meeting where they're asking a question, you're like, the answer is pretty simple, but I'm stupid, so that can't be right. But usually it is, right? And so we really want to elevate those voices as much as possible because we invited them here for a reason. So it means making sure they're heard, and then making sure when we say they're a partner, they truly are a partner, like start to finish.
Excellent. Yeah, thank you.
So what this makes me think of is I'd say related, but really deferring to expertise rather than trying to steer an outcome from the outset. So let me flesh that out a little bit more. Oftentimes, some of the greatest reforms or significant pieces of legislation that we've seen have come from prior years' studies or some sort of independent work that, say, a department of the state has taken on themselves to produce this sort of work product to say, hey, we studied this problem. We have prepackaged for you, legislators, what we think the solutions are. You can read it, start to finish, choose to act or not act, but here are our recommendations. Now, from the outset of that study, there are a couple different routes. You can, and it's very tempting, to choose what we want that outcome to be. So if I were today to undertake a study of, let's just say, permitting through the Agency of Natural Resources, I have a feeling, the housing advocate in me, I know exactly what I want that study to say, but if I'm going to go out and I'm going to engage stakeholders, experts in that field, I need to be willing to actually defer to their expertise. It can't be, as you said, this disingenuous, okay, we checked the boxes, look, we surveyed 50 people in the field, we surveyed this many towns, and here are our recommendations. We need to be very willing and comfortable with the fact from the outset that we are not in control of the result. That's hard when you're approaching things as an advocate and you have objectives you're trying to meet. And so, just owning that here's our mission, here are our objectives, but not feeling that control over the outcomes, that's really important. There's a lot of risk with that, but it is really important to get a quality product. And when it really is going to matter is when the time comes that you are actually trying to move legislation through. And that's my world, right? This is how things actually will get achieved in my world, is I convince enough legislators that this is a good idea that they're willing to say yes. And if the folks that are making the decisions, or that can be a blockade if they want to, if they feel that any part of the research was disingenuous or short-sighted, I'm out of luck. That's years worth of work that is just dead in the water. So.
Dan?
So written into our memorandum of understanding, the contractual language is use-inspired research. So that was essential to getting the MOU across the finish line internally. And we did a whole discussion, we had a series of discussions internally at Velco about what that means, what that will actually show up at, and what our expectations are for projects. So what we did when we started our projects is we explained our expectations. We were very clear. Here's what we expect, here are the deliverables we expect to see. So I think 2 weeks ago, we had a meeting in terms of the deliverables from our project. And on the meeting, they're going around saying, okay, we did all this analysis, we got all these great results. And at that point, we said, okay, well, here's the feedback that we have. You did all this analysis, you have all these results. One of our members of our project team, had done some diagrams to show here's actually what the type of analysis they would like to be done instead. And the response from the project team was, okay, great. we'll get to work. We'll do that because they understood that it was youth-inspired research at the outset. We had already established the expectations up front. It wasn't contentious. It wasn't difficult. Actually, I was thinking about it. I can take that for granted on our projects. They're just, everyone's there to bring that value. And we have had our fair share of lessons learned over the years where projects are done and papers are published and then, what was that? What happened again? But now we're actually getting deliverables that are going to be in GIS format that the teams can open up on their computers and get to work. And we are going to check in. Were they able to open up those files? Basic thing, but essential to being able to build trust.
Yeah, excellent. So I think we'll shift gears into Q&A from the audience, and maybe I would just sort of close these remarks by saying, I think we heard a lot of great things from our panelists. The two things that resonated with me as they were speaking are alignment and a sense of curiosity, or fostering a sense of curiosity. Those seem to be the two themes to me, but I'm willing to be wrong as well. But those are the things I will leave with you, and we'll sort of, I think we'll toggle, if there's something on Mentimeter, we might toggle in between, but let's take a question from the live audience, or the audience in this room first, if you're so willing. I mean, I saw people writing. Okay, yeah, there we go.
So Dan, a lot of times you bring different stakeholders and groups together. Everybody is speaking their own language, they've got their acronyms, they've got their own way of communicating. How do you break down the barriers and get people talking to each other as quickly as possible?
It's a great question, and one we work on every day. It's iterative, I have to say that at the outset, right? You learn as you go, but what we have found as being really useful is diagrams. Pictures can go a really long way. And so in terms of art, language, everyone has their own lexicon. You have many multi-syllable words, right, that everyone has, and acronyms in their heads. But a diagram brings people together.
I mean, I couldn't agree more. I am very visual, and I get very frustrated when I can hear two people saying the same thing and thinking they're disagreeing. This happens all the time. This happens at the state of Vermont all the time. Don't tell the governor I said that. But between the Agency of Human Resources and my department, we have to work together to mitigate the severity and length of homelessness. And while we're working on that exact same mission, my team and the Human Services team can think they're disagreeing, and they're saying the same thing. And literally, Dan, I have gone into meetings and either had a PowerPoint presentation diagramming things, or I've literally drawn on a whiteboard to make sure everyone agrees that what they're saying is either the same thing or something different. But let's just get on the same page.
Roz, anything to add there, or
No.
we covered it? Okay, all right. Do we have anybody on Mentimeter that submitted any questions? No? Okay. Questions from the audience? Yes, sir.
I don't have a question, but I have a recommendation.
Oh, so they can hear in the overflow room. Oh, yeah.
Thank you. Don't have a question, but I have a recommendation. Let me give you a small example leading into the question. I'll try to be brief. When Governor Douglas decided to run, I was part of the advisory group, you might say, and I took him to various places here in the state. And what he said to me was, Roy, if you hadn't introduced me to various segments of the population, I never would have had any dialogue with them. And so it was a mutually teaching or instructive and learning process. Many people at our university here have people in Burlington who've never been on this campus. At the same time, we are taxpayers who are paying your 5- and 6-figure incomes. And it's kind of like, we're here, you all come to us. And that town gown void or schism of sorts is common across the country in terms of colleges or campuses and universities. However, given our size, given the number of people here in the state. There's no reason why we can't be more community, a better, closer community. So I say, as we talk about, you use the word talent and you use the word workforce. There is talent, there is a workforce that frequently comes through this institution and they leave because they don't see people like me or they don't see people like, well, Native Americans, etc. on this campus. Yet there's talent, there's room, there is research, there is, one of my best friends is from West Africa. He just defended his dissertation, and the university immediately hired him. I'm saying that those who sit in seats, housing, sit in seats, academics, sit in seats, where you're looking for a population of able workers, there is a great workforce exodus here in Vermont at the moment. Another small example, and then I'll shut up. Dr. Prelog and I and a team were working on establishing this relationship between UVM and Jackson State. And somehow or another, the word of Vermont's history surfaced. And we started talking about the first 9 presidents of University of Vermont, ministers, pastors, etc. And one of the people around one of these PhD types, sitting around the table said, "What? UVM had a relationship with pastors?" And I'm sitting there speechless. You don't know your history. You haven't stepped into, because right down the street on College Street, you had one of the most effective abolitionists who was also related to this campus. Right down the street, in one of the churches I affiliate with, had one of the most effective editors or whatever, working with and involved in the community across the state. And he used that paper, that media platform, to bring about, but that was back in what, 1800s or whatever plus. And I'm saying that today, with much more modern means of communications and opportunities, we are in a place to make a difference, not only in terms of having great snow and Ben & Jerry's ice cream, as we tell the world about. There's much more we can do, especially in terms of retaining people who speak to tomorrow's with the demographic shift. We have an international airport out here. And for some departments, UVM, this campus, has more dialogue abroad than we do with people right here. In our population, that's only 660,000 folk, which is less than over 25 cities. We can communicate better. An audience of this sort, rich information, but there's still very select people who come, who we speak to. And I hate to say this, but I've called Montpelier a number of times and left messages, no response. So we can do better in terms of communicating, as opposed to that incestuous circle where we know each other, and especially if they look like us, we talk to them. Life is more than that. And I would encourage taking a look at different ways to reach out and touch and talk to people, especially with the faith community. Because if you take I said I'd shut up, I will, I promise. You know, if you take my culture, if you take my history, when you're looking for talent, where do you go in most communities across this country? You go to the black church, or you go to folk of color who walk that line. Some of you may remember Police Chief Larner. She came here from Georgia. And so I reached out and said hello to her, just to invite her, welcome her rather, to the state. And her first question to me was, where's the black church? First question. At that time, it didn't, I don't remember. But at any rate, I'm saying that there are places where we don't go because we have been conditioned to think that that's the only place you go.
Yes.
Just a recommendation.
Thank you. Thank you. Anything to add there? 4 minutes, and we'll come to close. So, anything?
I'll offer something brief, and I thank you for that, because you're absolutely right. And I think we all need to reflect and think about where are we going to get our information and access people. You know, a small example from my world, Governor Scott really tries to emphasize to us the importance of leaving Montpelier. It's especially challenging during the legislative session. You're in that building, seeing the same people who have been having the same wonkish conversations for 6 months, and you can start to get lost in minutia where you maybe lose sight of what you set out to do. The governor asks us to do something that he calls Capital for a Day, and this is something the governor started doing when he was first elected, and has really insisted that we continue to do it. And what this is each year we try to hit every county. The governor chooses a different county, and we go, and the entire cabinet goes to the county. He holds a cabinet meeting. We talk about what we're going to do that day, and we just go. We visit projects, we visit with stakeholders, we visit partners. We have someone from there take us around and say, here's what you need to know about our community. And I'm going to confess, we complain about it because it's not easy. It's really easy to just go to our office in Montpelier, log onto the computer, say I responded to emails, I've interacted with my state, I've interacted with my community. But what I'll say, when I leave a day, are there legislators in here? Okay, please forgive this. When I leave a day at the State House, I'm spent. You know, it's tough. I'm sure you feel the same way. Even though I complain about Capital for a Day, when I leave Roxbury or Alberg or Verchier, I feel great. I feel really excited, and I go back to my work, and I know exactly what I want to do that next day because they told me something that I had lost sight of or I just didn't think of. And so now my team is annoyed because I come in all charged up with a new idea, but I'm getting this idea from the community, not just from the same folks that you and I are talking to every day. So anyway.
What a great way to end our panel, everyone. Thank you so much for your time this morning.